what's up, everybody? It is your host here on the Kinetic Innovators Podcast, C.W. Hall. Charlie Whiskey coming to you. I've got a guest today, Brian Hill, Dr. Brian Hill, physician here from the Atlanta area, and I had the chance to meet him 9 years ago, on a show I hosted back in those days called Top Docs Radio, and we were talking about the direct primary care group that they were putting together here in the Atlanta area to provide a deeper level of interaction and time and focus on the patients that came to them through this, I think, growing way that physicians across the country are moving to deliver care to their patients. So, Brian, I appreciate you making some time today to come back by and update us on what's going on with HIPnation.
No, it's great to be here, CW, or Charlie Whiskey. I didn't realize that was Charlie Whiskey there, but great to circle back around and enjoy spending some time here with you.
They always want to call me CJ, so Charlie Whiskey kind of helps me out that down. So take us back in time. Back in 2017, you were just kind of getting started, and as I mentioned in the intro, your direct primary care. For the uninitiated. What are we talking about with direct primary care? We can start there and kind of talk about how the group came to be.
No, that's great. I think it's a great starting point there, CW. So direct primary care is actually pretty simple. Direct primary care is a movement going on in America. Physicians are really honestly to the point of being just exhausted and tired of having to deal with all of the coding, the billing, the prior authorization, pre-certification that comes with wrestling with an insurance company. And doctors are seeing 25 people a day, 30 people a day. They're not feeling like they're doctors anymore. One of the common conversations is physician burnout, right? All of this burden of a health insurance-based system is bearing upon the backs of primary care physicians and honestly, right, their patients as well. And physicians have decided that that's not why they went to medical school. And so what these physicians are doing is they're saying, I'm stepping away from that fee-for-service insurance-driven model, and I'm going to set up a shop. I'm going to hang a shingle, and I'm going to reach out to my local community, and I'm going to have them join my medical practice on a monthly membership, just like I would join a gym, and pay a simple monthly membership fee. And that monthly membership fee allows me as a physician to get rid of all of the overhead costs, all the insurance distraction, all the chaos that comes with that, allows me just to focus on you as my patient. And because I get rid of all that chaos, all that cost, I can actually knock down the number of people that I take care of from 2,500 to 3,000 people, knocks down me seeing 25 people a day to taking care of 600 people and managing 6 or 8 people a day and actually just really digging into them deeply as a doctor to keep them healthy and well.
And if I'm a patient and I'm engaging with a practice like yours, do I, most of them, or many of them anyway, come with some kind of insurance, or maybe I'm even a Medicare patient. Do I keep that? Does that do anything for me elsewhere? Or tell me how that is affected by me coming to you for my primary care.
Sure. And options, right? So this is, I think, for us and putting in HIPnation together, it was really rebuilding the foundation of healthcare from an idea of a concept of let's rebuild the healthcare ecosystem. So just conceptually, that's what we've done in HIPnation. The foundation for us is that direct primary care, and people who join us on the direct primary care, and people almost might kind of couch this as kind of concierge without the panache, if you will, right? It's a kind of a concierge, high touch, personalized care, doctor's cell phone, all of that wonderful stuff, except we just don't need to have the chandeliers in our offices, and we're certainly not going to work with an insurance company. It's just working directly with people. And on the primary care side, people can join us as a membership model because we don't have all of the panache, right? The cost is a lot less than what people would pay concierge. And, some of those people might say, hey, I've got my Medicare, or I already have my insurance, that you will be getting from my employer. But what I'm not getting out of that is access to a primary care doctor that's going to focus on me, take care of me, love on me, be available when I need them, right? They don't have all of those other component parts that should be coming with primary care. So one, we have a group of people that join us and they have insurance. Our ecosystem mindset, our idea of being revolutionary and transformational, and we can delve into this further as we go along, is that we actually also bring products to the market for individuals, for employers that actually partner and pair very well with our direct primary care foundation, that add to that extra piece if we need for seeing specialists, ambulatory surgeries, hospitals, right? The catastrophic things that we worry about, right? We've got partner pieces that bring and we embed into our ecosystem on top of the direct primary care foundation.
With the direct primary care model, obviously a big component of that is being able to be seen very quickly. I know my in-laws, they're in that traditional Medicare, primary care / specialist kind of model for their own care. And sometimes they have something going on. They have, they call their doctor and it's weeks sometimes before they can actually be seen. Obviously, that's one of the great benefits here is, I've got, you're at the end of a phone from me for one thing. I can talk straight to my provider, but rare is the opportunity for me to have to wait. I can be seen very quickly if I need to be in this kind of model.
100%. And it becomes that all-encompassing piece, really, if you will, from the primary care side. One of our primary care physicians, says it's almost like I have my doctor in my pocket, right? It's us being able to actively participate and engage and partner with our members to be available for them, when they're sick and when they have a medical issue. But it's also, right, allows us to have the time and the bandwidth to sit down and spend time to get them, know them well, engage with their lives personally, focus on health and wellness, be proactive instead of the reactive healthcare system that we're in, right? The idea in our primary care foundation becomes, let's rebuild health and wellness in our society. That's sadly, I think, being missed in the primary care model we have today, because that's the point of primary care, is staying well. But we definitely want to have that access point, that when the body does go sideways, I want to be able to have a doctor I trust that knows me, that's the quarterback of my team, that's actively walking alongside me to help me through that process, right? It's creating that, that partner in this journey of life.
When it comes to the side of, you mentioned health and wellness and obviously preventing me from getting diabetes or getting worse with diabetes if I'm getting into the early stages of that. Talk about that. Are you saying that that's something you're going to actively focus on? You're going to sit me down and say, maybe we drink 1 or 2 less beers every night, Charles. Maybe we have pizza a little bit less. You're going to get into those types of things with me. My lifestyle choices where you're going to actually counsel me that might help me not develop the chronic illness, or if I do have one, perhaps I might be able to possibly eat my way out of it, if you will, by improving my diet and that kind of thing. Is that what you're talking about?
100%. It's interesting. Like one of our, I always relate back to some of the primary care physicians that we work with, and one of my primary care physicians goes, when I was in that fee-for-service world, I felt like I did 2 things. One, I was a referral monkey. I just referred everybody out. I didn't have time, right? So everybody was going out to seeing a specialist, and I really wasn't doing much for caring for them, but I was just sending. And the second thing is I was just a prescriber of medications, right? I was somebody who did nothing more than prescribe pills to manage preventable chronic diseases, as opposed to stepping in and going, hey, CW, how do I actually work alongside you to prevent preventable chronic diseases? In today's healthcare system and studies, right? And if you look across the spectrum, I think our system is failing. A lot of reasons that we're seeing this in our society, right? But we have a level of unhealth and sickness in our society that is pervasive, and it's getting worse. It's not getting better.
Not truly.
We spend more money in healthcare than anybody other country in the world. We prescribe more medicines than any other country in the world, and yet we're still one of the sickest countries in the world. Maybe the idea needs to be that our primary care should be foundationally focused on keeping me well and healthy, not just trying to be the best prescriber of a drug to minimize, right, the chronic disease that I'm currently dealing with in my body. We've got to change the dynamic of primary care, and you just can't do this when a doctor's seeing 25 people a day. It's just not possible. That's why we've got to change the foundation in order to build a better healthcare system.
In your experience as you've gotten this started, are you seeing people still wanting to kind of do it the old-fashioned way where I walk into the office? Or are you seeing, with the availability of, very good technology now to be able to do remote visits, kind of like this sort of interaction almost, or just on the phone. Are you seeing more of a movement towards that kind of care delivery once you've kind of gotten me established as a patient? What's that kind of like now?
No, 100%. I mean, it's interesting. I'm a big believer that relationships matter in this world. When we talk about trying to change behavior and engage with people, and trust, right, is a huge piece towards creating that level of partnership and agreement that we're really aligned together in your health and wellness. So I'm a big believer that let a doctor lay hands on you. Let me love on you. Let me shake your hand. Let me give you a hug, right? Let's build that relationship, because that's not transactional, right? That's personal, And so I worry a lot about in the world of, right, ease of telemedicine or these conversations or texting, right? Sometimes we lose that personal piece that does help, right, motivate change. But once we built that relationship, once we started that engagement, then you go, now let me use these tools like telemedicine or texting or phone calls to magnify what I'm able to do, right, to engage with you on a more regular basis. That doesn't necessarily have to be synchronous, right? It can be asynchronous, or it could be a telemedicine visit that's easy to manage. But now it becomes part of the coaching process of, right, bringing on and managing and continuing with the care plan that you and I established. It's, right, creating the partnership in this journey together, the accountability that helps motivate and create lifestyle change. Right now, we can use all of these different modalities to achieve that, but they're not really going to be achieved until that relationship and that trust is built in the first place. I tell people we've commoditized, like, the concept of primary care into this little box, as opposed to really taking a look at it and go, what is a really valuable primary care supposed to look like? And that's what we want to be reflective of, is a primary care that really truly brings value, engagement, and relationship building into the world.
When I come to you as a patient, what's the team look like that I'm going to interact with in the office? Is it much the same as what I would see in my traditional primary care office, or do you have more resources, like maybe a dietitian that's going to counsel me on my nutrition? What kind of folks do you have as a resource?
No, great. I'll start with the office. I think this is the one of the beautiful pieces. So just offices in general. I just like offices being comfortable. We have too much sterility in the world of medicine, and sterility doesn't build trust and right, doesn't build relationships. So I just like a cute office, to be honest with you. I like soft chairs. I like something that feels like my home, but I also, you'll find in our offices, is that we don't have it burdened with a bunch of people, right? I don't have people coding and billing and doing prior authorizations and pre-certifications and having to fight with insurance companies to try to get, reimbursed, right? All that stuff is gone. It's the keep it simple, stupid principle. So that in our offices, we usually have one medical assistant per doctor. The medical assistant is as much as part of the care team as the doctor is, right? We're all working together. You come in our office, CW, our MA, or, right, our medical staff, they're going to know who you are, right? They've spent time talking with you, as like the physician has, right? It's a greeting place of people knowing you, right? It's not the assembly line medicine mentality first and foremost. Because you should be somebody that's meaningful in the office, right? So one is built on that, and then on the physician side, then we can talk about, like I said, the dietitian and things like that sort. But just in empowering the primary care piece, so we are certainly a big believer in a holistic approach to medical care, mind, body, soul, right? Food is medicine as much as it is fuel. Exercise and movement is the key for longevity, right? Those are the pieces that we're going to espouse. Our primary care physicians actively engage in that kind of a lifestyle medicine, mindset, if you will. Mm-hmm. And because we empower doctors with time where they can sit and have an hour and a half conversation with you, right, we're able to sit down and talk about diet changes and lifestyle modifications and sleep management and stress management. Right? We can have that personal conversation with you as an individual without necessarily having to bring an adjunct alongside. I'll throw one little thing out there. There's been studies out there, and there have been questionnaires asking primary care doctors, how much of your training in medical school and residency do you actually apply in the real world? And most of those primary care physicians will tell you about 30%. Right? We have a highly talented, right, highly educated group of people that are only working the 30% of their training because they're distracted doing all of the coding, billing, prior authorizing, pre-certification, managing all of these people, instead of focusing on what they were trained to do, be a doctor for people. So our first motive is going, let's actually free the doctor up and empower them to work to the capacity of their abilities, and then let the things start falling in place from that point forward.
I can see why somebody who gets involved with this kind of care, would want to stick with it and potentially have better outcomes than somebody who can only take 5, 10, 15 minutes at the top with them, especially when they are predisposed, or maybe they've got some lifestyle choices that are kind of heading them towards some chronic illness. That if I had the time to, really drill home, hey, these are some things that you can do if you'll make these changes that can keep you healthy longer. I can see why someone would stick with that. And when we were first talking years ago, that's kind of where you were. You were getting started as a direct primary care group here locally. But as I understand it, looking back into what HIPnation is doing, you've taken that concept now and you're talking to employers and saying, hey, let us be the source of primary care for your patients. And then I guess even beyond that, you've further advanced that into not only being able to help employers, people be able to be better managed for maybe a little bit less. You further went and formed an actual health plan to deliver this type of care for employer groups, like small to mid-sized groups. Talk a little bit about that metamorphosis and the trajectory that you've taken kind of as you've begun to add those components to the group.
No, that's great. And this has been part of, like I said, a long-term strategic play. Like I said, we very much approach this from the perspective of medicine and physicians and going, right, what are the problems that we see, in the healthcare system, attack those problems, and then, right, build a treatment plan around that. Right. So that's the concept and mindset that we've carried through here with this. Is to that end, we started with what we thought was the most important aspect of primary care. Let's rebuild that foundational piece to keep people healthy, keep them well, keep them out of the emergency room, right? Keep them out of urgent care, allow them to access their doctor, empower their doctor to be well, right? All of those things, right? One, we love it as doctors. It makes life for us fun. Our members get healthier, they get well, they avoid unnecessary expenses. But now if you turn that and look at this from the perspective of an employer, an employer goes, wait a minute, what you're doing to my employees, and a health plan that we'll talk about, is that you're making my employees healthier. You're helping decrease my healthcare spending, because if my employee doesn't go to the emergency room, right, that saves our plan money. If my employee is healthier, they're not going on the diabetic medications that are, right, causing so much cost in America right now. My employees are actually being able to come to work instead of having to go, right, to spend time in a physician's office, or perhaps really, right, not being healthy enough to come to my workplace. So, right, the idea becomes we are now starting to replace the key pieces that are not working well in a traditional employer-sponsored insurance plan. So we go, come in, one, let us replace that. And we have some employers that go, hey, I'm going to stick on my insurance plan for the catastrophic stuff. But goodness gracious, this foundational piece is lacking. Let me bring you all alongside. And in my self-funded plan, by you re-empowering primary care for my employees, you're going to, right, help us provide a better product to our employees, improve the morale of our employees, and improve our healthcare spending. So one, we can come alongside a current employer plan. But two, to your point, we've also stepped into this world and said, well, let's do this. Let's create our own insurance plan. Let's rebuild the entire construct of insurance on some simple principles. One, the great aspect of primary care is key. Healthier people are less expensive people on an insurance plan. But two, right, the second economic principle that we believe in is economic efficiency and payment. And what I mean by that is that we believe in direct contracting for care, that steps outside of the primary care space. So that if an employee needs to go out and have imaging, we have two different ways to pay for imaging. We can have that imaging center charge an insurance company and try to fight with that same administrative bureaucracy and cost that exists in the primary care office that we just got rid of. Or we can tell that imaging center, well, let us have the employer just pay you directly for the CT scan or the MRI. Let's buy it today from you instead of you waiting 90 days to get paid. And guess what that imaging center says? Goodness gracious, if you pay me today instead of me fighting through the bureaucracy of insurance, I'll charge you as an employer less. You can buy it from me at a lower price point. And the same thing is true for ambulatory surgeries or specialty office visits or even hospitalizations. Right. So the second piece that we build our plans around is don't buy healthcare through an expensive insurance bureaucracy. Let's instead just go buy it the same way I buy, the jacket that I'm wearing or the shirt here or the computer that you and I are talking through. let's go have it be bought directly by the employer plan. And what you'll see in that now is the price per unit of care drops, right? It becomes more affordable to buy medical care. And so now if we say we're going to take better primary care, we're going to buy services directly for labs, imaging, ambulatory surgery, specialty care, and hospitalization. We're going to buy that directly. Now we can take, right, an insurance, and we call it reinsurance, and wrap that around our healthcare plan. And we're going to be able to charge less to that employer for our health insurance plan because it's a better plan and buying healthcare services at a lower price. So now the overall insurance plan is smarter, more cost effective, and provides a better product to the employees. We're basically picking out Blue Cross, United, Cigna, Aetna, and these insurance plans out here and going, let's go and build a community health plan where CW, if you come and see me as a urologist, why don't your business just pay me directly instead of your business paying through Blue Cross Blue Shield that's up in Chicago, that Chicago is going to take 20% off the top. And then it's going to make me fight like crazy to get paid 90 days later. Why the morass? Why that game? Let's just pay direct and work directly together. And I win as a doctor, you win as an employer because it costs you less to buy my services. And the insurance that we wrap around that is actually now less expensive. Everybody wins.
A lot of those, obviously, those larger companies, those larger plan types, just as a nature of their structure, come with administrative costs cooked in that they are not going to really be able to get rid of, that you're going to be much leaner in your layout of the organization and being able to, based on what you're saying, I go straight to the organization that's doing the service rather than going to an insurance plan that then has some kind of billing construct where they bill me 2.5 times their Medicare rates so that I can give them some portion of that back and wait until I pay them. I can see where if I'm an imaging center, how that cost of money, the time that it takes for me to submit a bill and either fight for a claim, come back and find out it was paid as a zero for some reason, or all those games, how it makes total sense to link up with a plan like this. After several years of being an operation like this, do you have data now that you can come in and talk about, here's how our cost stacks up, and not just premium cost, but to be able to show, hey, this is what our typical spend looks like on this type of employee, panel.
100%. Yeah, the beautiful piece, and this is like I said, this is our heart. Is two things. One, right? How do we drive down the cost of care today? Right? We've got to drive this down, and we can do that by buying healthcare services at a lower price point. Right? I mean, I can buy an MRI for $400 that the insurance companies are running out there for $1,200, $1,500, right? And that makes insurance premiums expensive. So one, let's go in here and drive down the price point of the cost per unit of care. Let's provide better care and get people healthier for the long haul. But the beautiful piece of this is kind of the experiment that you and I first started talking about 9 years ago, right? The fruit of that is that now we're seeing, right, the insurance premiums that our plans are charging to employers are anywhere from 10 to 35% less than a traditional insurance plan. Our renewals, right, are running, less than traditional insurance-based renewals. Employees are getting healthier, right? They're getting care time with their physicians. We're starting to, right, move the needle of not only how we controlling costs today, right, but how do we actually promote a healthier society, a healthier workplace, a healthier workforce for tomorrow? How do we bend that long-term cost curve of healthcare down? And we're seeing that in the renewals and the groups that we're working with, that the fruit is being born of simple economic principles and healthcare the way it's structured, the way it was supposed to be.
I can just imagine how the employees' experience of just pure access, and layered on top of that kind of the we're here for you kind of experience that they're going to have in this type of care delivery model. Talk about the company that should be picking up the phone and calling HIPnation. Who is best served by the HIPnation plan?
No, thanks. I appreciate that. No, so I have a heart. We have a heart for small businesses. I think they're the lifeblood of America. That is really kind of our target, is that small business group. We really love we work for companies anywhere from 5 to 125 size employee-based companies. they're the mom and pop shops of that drive the economic engine that is America, right? Those are our community companies. They're the people that, right, drive the economic engines of our local society. So really our heart is in that space, in kind of replacing our insurance, replacing our insurance plan and bringing us on board.
And what's that process like? You have, I guess, somebody that's in sales that they just link up with. Through your website, they're going to contact you to say, hey, tell me more about this health plan you have.
Yep. So they can reach out to our website at HIPnation.com, and they can just request a quote and ask to get engaged with our sales team through that channel. Certainly, we work with brokers as well. So health insurance brokers or advisors are the distribution channel for the health insurance. A lot of employers already have a broker that they work with. We were actually at a broker meeting here this morning, and that's where I'm coming from, where we were actually presenting to them our concept, what we do. There's a lot of interested insurance advisors that are going, I'm trying to find something better for my clients, and yet I've been only able to shop in a world of Blue Cross, United, Cigna, Aetna, and they're all broken environments. We know it's not working, but it's all we have, and we've become a wonderful arrow in their quiver, right? That they go, hey, I can take something out that's actually healthcare first and healthcare focused, that is affordable. And so you can, these companies, they can say, hey, if they have their broker, they can always reach out to us as well, through their broker, and push their broker to contact us.
Now, are you serving primarily Georgia-based employers? Talk about the footprint.
Now, sure. Our focus is, so I like going deep, into a community. So our focus now is the Metro Atlanta area. We kind of really drew a line of about 25 miles around the 285 around Atlanta, as far as our hyper focus. We started running wide and fast early on and made a decision to consolidate and really kind of get into our backyard here. So that is our focus is Metro. We do have employers that have people scattered throughout the United States. There's a revolution of healthcare going on, which is a beautiful thing to see, because there are physicians that are doing this direct primary care movement around America. We're all connected together. It's a kumbaya kind of movement that everybody wants better healthcare, and doctors are wanting to be part of the solution and are feeling empowered to be so. So focus on Atlanta, but the capacity, if people have some outlier, employees or locations, that we can accommodate them as well.
So anything that we left out of our conversation here before I let you get back to your day?
Now, the only thing I'd say, and for me, like I said, this is personal. I love being a doctor. I love what I'm doing. I was called to be a physician, and we as a society have almost become a little bit, I would use the word maybe indoctrinated. Maybe you can call it learned helplessness. It's almost like we just block out this concept of health insurance, and it just drives us crazy every year when we have to go through renewals. We just don't want to think about it. We need to step outside of that comfort zone and that complacency and go, am I really, as an employer, providing a benefit to my employees that's getting them healthier and getting well? Because the employers I know want that, but it's going to take that impetus of going, I'm willing to promote change to lead my organization and my employees into a better tomorrow for their health and their wellness.
Where do they need to go for get more information?
Yeah, so perfect. So they can reach us at HIPnation.com. That's just HIPnation.com. They can reach out to us there. There's a request a quote info site there. And there's a phone number on our site. They can reach out and contact us as well. And we love to be partnering with people because, again, I think people are worth it. I know people are worth it. And we're excited to be part of the journey of these employers to try to help.
I'm definitely pleased to have a chance to have you come back and talk more about HIPnation, where you are today. It's cool to see you all having done so well over the past 9 years. So it's a pleasure to have you back and talk a little bit more about all the things that you're doing now. It's pretty cool.
No, thank you, CD. It'll be great to come back and circle back around, and maybe we'll have another conversation in hopefully less than 9 years, and we can talk about the next stage of this evolution.
If you haven't done so already, make sure you link up with us, all the social medias that you're probably involved with. We've got our stuff posted up out there. Also on Spotify, if that's one of the places you like to go to listen to podcasts, we're out there as well. And Brian, I appreciate you making time to share your story today.
No, you're welcome. Thank you, CW. Have a blessed day, man.
All right, man. Everybody out there, we'll see you next time. Talk to you then.